Long QT syndrome is a disorder that affects the heart's rhythm, causing dangerous arrhythmias in response to stress. During one of these arrhythmias, the ventricle beat fast and irregularly, and the heart cannot pump the blood through the body. This is shown on an ECG as a prolonged QT interval, which is the time it takes the heart to retract and recover. People with long QT syndrome have a defect in the ion channel, causing it to take longer for their heart to recharge for the next beat. Risk factors include being born deaf, having unexplained deaths in young family members, taking certain medications, and having blood relatives with the disease. It is a rare disease occurring in 1 in 5,000 in the United States. Symptoms include fainting from a lack of blood to the brain, seizures, and sudden death. If left untreated, 1/2 of individuals with the inherited form of long QT die within 10 years. There are numerous treatment options available, including medication, avoiding exercise and stress, change in diet, inserting a pacemaker, and having family and friends monitor the patient closely.
Long QT syndrome, LQTS, has many varying genotypes that lead to similar phenotypes. Some work as an autosomal dominant, and some are autosomal recessive. We will be focusing on the most common form of LQTS, LQT1. This form of LQTS involves a mutation of the gene KCNQ1, which is located on the P arm of chromosome 11. This gene codes for the protein KVLQT1, which is a subunit of a voltage-gated potassium channel. The mutation is usually a missense mutation in the KCNQ1 gene and leads to a channel that is inefficient at allowing the current of potassium ions to flow into the cell. This slows down the rate of hyperpolarization and causes the increased duration of the action potential seen on an EKG scan.
For an experiment, we want to look at whether it is a lack of flow of ions that causes LQT1, or whether it is conformational change in the ion channel that causes problems in signaling cascade. To do this, we will use mice as a model organism because they still react to long QT syndrome in a similar way to humans, even though mice have an accelerated heart rate. We will take wild-type mice with long QT syndrome, and mice that we have transfected with a strong promoter placed in front of the mutated KCNQ1 gene. We will then stress the mice to see which ones show symptoms of long QT syndrome. We hypothesize that if it is a lack of flow, the wild type and the strong promoter group will have similar phenotypes due to the additional channels that are expressed due to the strong promoter. However, if it is due to a physical change of the protein, the mice with the strong promoter will have similar phenotypes to the normal LQT1 mice.